Hi, everybody. Thanks for tuning in, or if you're watching the recorded video, thank you as well. Feel free to share this recorded video, like I had mentioned last week, on your wall. If you folks did that, and I greatly appreciate that. So when I'm done, it will show up on my on the news feed, and feel free to click share. As I say, the more shares with this type of content, the more people are talking about it, and that's the whole point. So. Also, as I like to say, these are my opinions and my opinions only, and I'm not a mental health professional or a therapist, or don't play one on TV. I have borderline personality disorder. So no major updates in my life. Work is going well. I'll be headed to Sculpture Park next Saturday, which to provide some awareness and education and hang with the Pokemon crowd, so I'm excited for that. I'm trying my hardest to live day by day and not get too far ahead of myself in my life right now. And, I still have a long road ahead financially in a few areas in my personal life, and I'm trying to put myself out there a little bit more, and so I can, maintain more of a work life or a balance with work, awareness, advocacy, and some type of social life, which is always important. So, tonight's topic is actually falling through the cracks in our mental health system, and my personal testimony to that. And just a forewarning, I can get a little passionate about this topic, so please bear with me. Plus, the Cubs got romped today, 11-4, and so I'm not. If I don't see myself, that's why. So, but still, best record in baseball. So, with that said, we'll move on to the topic tonight. First, I want to talk about the gap in our Medicaid system. Medicaid is confusing, and it was confusing before all the changes, and quite honestly, it's even more confusing now. So all I've been told is what, or all I know is what I've been told by the folks at DHS on multiple occasions. It's important for me when provided information from DHS that I actually call back and talk to a different person at a later time regarding the same issue, because many times it's even so confusing to them with all the changes that they don't always provide accurate information. And, this comes from personal experience. It's nothing against the employees at DHS. It's just something that I have to do to make sure that I verify what I was told. But the information that I was told when I was really seeking intensive residential treatment was pretty disheartening, to be honest with you. While I was at my worst and wanted full-time psychiatric treatment, I was told that because I did not have children under the age of 18 living in my household and was not collecting disability, my MCO, which is AmeriHealth, or was AmeriHealth, did not cover full-time residential psychiatric treatment. Therefore, in order to receive that full-time residential psychiatric treatment, I was required to complete an application for a mental health waiver. That sounds great. I thought that, that was my in. But the kicker is that in order to qualify for that mental health waiver, I needed to be blind, over 65, or collecting disability. Now the whole point to me is, when it comes to the full-time residential treatment, was learn how to live with and manage the symptoms of BPD, so I wasn't required to live the rest of my life on a government check. I was suicidal daily. Outpatient services, they just weren't enough for me. And, I'm one of the lucky ones who survived this absolute hell of an existence as I continue to be pushed away by our system, a system that is supposed to help us. I've been to outpatient before, and some of them are great. Some of the programs are awesome, and people can benefit from them. But I'm telling you that for someone that spent 4 hours a day on suicide forums, exhausted all of my mental energy just to get through the day alive, and was living in absolute hell each day by day for months on end, outpatient services weren't enough. And that's why I was really seeking that full-time residential treatment for a life overhaul. I was begging to be saved. I wanted to be saved. I was crying on the phone with them, phone call after phone call, just asking them to save me and just to tell me yes, but the answer was always no, and it was so frustrating. Even if I did receive full Medicaid and was approved to go into a residential treatment center, I wouldn't have been treated for my specific condition because the facilities that are available don't have the staff that are properly trained to treat borderline personality disorder. And I reject any argument that states that BPD is most effective with, it's most effectively treated on an outpatient basis. How can one make that argument if they're not comparing apples to apples? We've never had an abundance, ever had an abundance of residential treatment centers that are specific to borderline personality disorder. So if our entire history of our mental health services, if 95% of the available help is outpatient, then the argument that inpatient services are less effective is complete hogwash in my mind. For those functioning BPDs, maybe it could be more effective. But what about those who never even seek outpatient treatment because they know that they need more in order to change their lives? People want that major life overhaul. They know that they need it. And one of the sayings that I love is, in any recovery, is you need to only change one thing, and that's everything. And outpatient services many times, going, on a daily basis for an hour or a couple hours a week in group therapy, it's just not enough. That leads me to the next issue, which is our lack of beds in the state of Iowa. As many of you know, we're dead last in terms of in the United States in the terms of mental health resources and bed availability. And our governor cut 2 out of the 4 public institutions that do accept Medicaid and is looking to potentially cut the other 2. I don't know, but I don't know where he expects people to go. I'm not trying to make this into a political argument by any means, but bottom line is, even if I did have full Medicaid and say that they actually would have adequate treatment and experts in how to treat BPD at these remaining facilities, which they don't, there would be a waiting list. And with this waiting list, we're talking up to possibly 3 months or more. And for someone with borderline personality disorder, that waiting time could literally kill them. For a disorder where impulsivity, addiction, violence, and a suicide rate of 10%, which by the way is extremely low, compared to what it should be if we would correctly diagnose, we're just waiting for something unpleasant to happen during that time. Personally, I wouldn't be satisfied if we were ranked number 2 in the country, and I don't think our government should be either. Being ranked dead last is unacceptable, and we should be striving towards becoming number 1, not just trying to get out of the cellar. Next, I want to talk about the connection with the Medicaid gap, mental illness, and our homelessness problem in the city of Des Moines. As I mentioned before, we have 2 main shelters in Des Moines. Both are bed bug infested and overcrowded, and there's many people that can, attest to that. And the city plans to tear down yet another tent camp in the upcoming weeks ahead. As I mentioned in the conversation with Mayor County, if we want to get people off the streets of Des Moines, then what we need to do is provide them with an alternative place to stay by building another shelter, stop the evictions, as well as working towards improving our mental health system in the state. I've spoken to quite a few people while I was on the streets, and quite a few people since I've been on my feet. And a very large percentage of these folks suffer from mental illness. If they wanted to get help, and some of them don't, but if they wanted to, and if they wanted to go into full-time psychiatric center to stabilize them and provide them with the right diagnosis and medications and give them just a fighting chance to live and live happy and healthy and become productive members of society, then we need to give them options, not take them away. We need to get to them into facilities and not tear them down. Back to the Medicaid gap. Many of these folks on the streets have no insurance. And if they do, many of them have partial Medicaid due to the fact that they had no children under the age of 18 living in their household and are not collecting disability. And even if they did collect or apply for disability, many times it takes more than 12 months, sometimes even a year and a half for disability to go through. And many times they're actually denied, on multiple occasions before they're actually approved. That yes, they do get back pay, but what are people supposed to do in the meantime? And I can attest to the fact that most people out there on the streets do not qualify for the mental health waiver, as they're not blind, they're not over 65, some are, but most aren't, and they're not collecting SSDI. So if we want our citizens to get off the streets, then we need to focus on how to get them healthy and keep them healthy. That's the most important thing, which leads me up to my last point. You know, we have another gap in our healthcare system, and this one, it really bugs me a lot. You know, although Medicaid does have its major flaws, it does provide many good services. I don't want to be all negative here. It does provide a heck of a lot of great services. While I was on it, I was able to attend weekly therapy, and it was covered 100%. But what happens when individuals get on their feet? They find employment and obtain health insurance. You know, in my case, I can no longer afford to go to weekly therapy. I now am above the income threshold, so I don't qualify for Medicaid. I'm forced to either apply for Obamacare or take my employer's health insurance. And I'm currently paid through an actual staffing service, which does cover mental health services, which is great. But after my basic financial obligations are taken care of, I can only afford a high deductible plan. Therefore, I'm paying 100% out of pocket for therapeutic services, which means I can only afford to go therapy twice a month instead of weekly. You know, and I think I'm going to be fine there. I know I'm going to be fine there. I have a lot of other things, a lot of other tools I can use. But the fact is, you know, my therapist is awesome, and he's an expert in borderline personality disorder. I want to go to therapy, and I like it. You know, there aren't many people out there who are specialized in this. He's been doing this his whole career. You know, so if I'm not working, I can go to therapy even twice a week, and it's paid for if I wanted. But if I am working, I need to make the choice of putting food on the table, paying bills, or going to therapy in order to maintain that healthier lifestyle I'm living and continue to make improvements. You know, our system is broken. It really is. And I don't have the answers on how to fix this. You know, I can't give an expert opinion on how to fix our Medicaid system or general health care system. I'm not that smart. But I do recognize a problem when I see it. You know, I'm not paid to come up with those solutions, but our government officials are, and they are letting us down. You know, I'm not in charge of our city and state budget, but for the ones who are, they really need to take a closer look at the thousands of people out there who are suffering daily without the proper treatment or resources available to them. You know, people with mental illness and those with borderline personality disorder can't just snap out of it. You know, it just doesn't work that way. If they could, they would. You know, fortunately, many out there can benefit from outpatient services or go to therapy a couple times a month, but so many can't. You know, we need to figure out a way how to fill those gaps and take care of all of our citizens. You know, all of our citizens, including, you know, functioning members of society with or without mental illness, as well as the ones who spend each day in constant misery, fear, and emotional chaos and turmoil. So thanks for listening tonight, and go Cubs. Have a good one.